Circle of Care Awards. This year's Circle of Care celebrates the year of the healthcare worker in front of and behind the scenes.
Good afternoon, everyone. My name is Shirley Demosthenes Atkinson, Chief Executive Officer of CABS Health Network. Thank you for joining us for our third annual Circle of Care Awards. On behalf of the entire organization, we celebrate our honorees.
This is a very important, I think, idea that we are celebrating the frontline workers and health workers, especially during this COVID pandemic that has faced the world. And CABS is their health workers that have served the community, as I said, a marginalized community, a community that everybody is saying, well, they're behind, they don't have enough services. CABS is right there to make sure with its health workers that they're there and providing services to people that need the services the most and the people that are suffering the most because of neglect, low income, and I'm just very proud that we can honor our health workers because of their work and their mission and their perseverance, especially under this COVID situation.
This Circle of Care Award is being presented to Isabel Fiumano.
Hello, my name is Isabel Fiumano. I work in the finance department. I've been here between 13 and 14 years, maybe a year more. I'm in the payroll department.
How has this year changed you?
It was a little bit unnerving at the beginning because there was something happening that you didn't know what was going to happen. But I also witnessed fear, not personally, but from other people. Fear of going outside because somebody might just go, and oh my God, they got COVID. So it was a gamut of feelings and emotions that one never experienced before, because in my lifetime I don't recall a pandemic like this one. You know, we've had a flu, we've had this outbreak, that outbreak, but never something so serious. So you see your coworkers in fear, those who might have their immune system compromised for whatever reason, they find themselves homebound, working from home, but nonetheless homebound. Because if you have your immune system compromised, you become a prisoner of your home. And people have become sort of, I wouldn't even know what to call it, petrified. If you're on a bus, and Lord forgive you if you cough, everybody turns around and gives you dirty looks. People forget that there are people out there with asthma, allergies, or even the common cold. But it's an experience I don't wish on anybody. One of the things that you would find is respect. You will be welcome as another member of our CABS family, and there is room for growth. Coming to work every day to the office, it's fine if you're able to work from home, but in here, it's like a safe haven, so to speak, because once you walk in those doors, nobody's walking in. Only the few that were in the office to keep safe, distance and everything else. It felt safe, even though there's a pandemic going out there, but not in here. I felt safe here. It's a good atmosphere. You walk in the morning, good morning, and sometimes we forget where we are, and we scream over to the other side. But no, the atmosphere is good.
My name is Bernadette Quick, and I am a home attendant / PCA / home health aide with CABS Home Attendant. I've been an employee with CABS since December 1998 until current. During my years that I have worked with CABS, I had the privilege to work with many different clients. But the clients that I hold dear to my heart are the autistic ones. Honestly, when I started home care, it was a job. I didn't take it as all that it has turned out to be for me. CABS have taught me that dealing with home care is bigger than just clocking in and clocking out. I am put there to make sure that whatever client that I'm dealing with has ability to go on with their daily living. Dealing with, different people, and always, it's a true saying where there's always somebody worse than you. And it's hard to go to somebody's house 7 days, 5 days a week and have no attachment. So then my heart became passionate, and I put more into what I was doing within my job. I understand that it's bigger than just what it is. And dealing with CABS, it's like it's a home, it's a team. This year, with me being a home care worker, working under the pandemic, and all that we've been going through this year has really taught me how to be a team player. I had to deal with a lot of decisions in home and at work. Coming to work every day, knowing that me just getting up, going out to my client's home, made it just well worth it. You know, when the world said, stay home, don't do this, don't do that, you know, my job was like, you are basically a frontliner. You have to go out. You have to assist these clients who may not have no one to go in. Me and my coworkers that I deal with, you know, instead of being able to talk to them and relate to them within the agency, you know, we do the messenger. I haven't messaged so many home attendants in Zoom since this pandemic. And it gave me a different outlook on when the tough get going, we gotta go harder. And I am truly grateful that I was able to do all that I did for my client during the pandemic. And just not for the client, for the agency, you know? And it was just overwhelming at some times, but if I had to do it again, I would.
This Circle of Care Award is being presented to Elena Santana.
Mi nombre es Elena Santana, trabajo para la agencia de CABS desde el 2002 hasta esta fecha y me siento bien complacida de ver el trabajo con CABS. Yo estoy vacunada, tengo las 2 vacunas. Mi experiencia en esta pandemia fue que somos una lucecita y aprendí también que hay que ayudar al prójimo. Me sentí mal cuando me enfermé, pero al recuperarme cogí mi trabajo otra vez para atrás y me siento feliz de ayudar a otra persona. Por eso es que me motiva a que me reconozcan por mi labor, porque gracias a Dios y gracias a mi familia por siempre apoyarme y ayudarme en todo momento. Y vuelvo y digo a CAP por tener tantos años yo aquí y siempre ayudarme en todo. Gracias.
We have our Circle of Care Awards on October 1st, the United Nations International Day of Older Persons to honor the aging population. This year's theme is digital equity for all ages, which includes digital access, capacity, and literacy for older persons. COVID-19 exposed our digital barriers in providing virtual care such as telehealth. Even at CABS, we had to make enhancements in our digital footprint and access. This meant changing the way we communicate with the frontline staff and clients. We launched our virtual fireside chats, provided them with information and support on COVID vaccine, and our nurses conducted virtual wellness visits for our caregivers and telesupervision of the services. Keeping our doors open through the year meant keeping virtual outreach open via all the platforms: Zoom, Teams, Google Meets, Hangouts, you name it. We are fully committed to supporting digital equity in our virtual climate and beyond.
This Circle of Care Award is being presented to Ugweti Roberts.
I was employed at CABS 2008, January 7th. And I have been employed as a CQI monitor, which is a continuous quality improvement monitor. So far, I have enjoyed working at CABS, although it is very challenging, especially during the COVID time. But I look forward to come to work and work with my coworkers and everyone. Thanks to everyone at CABS for the dedication that they put towards the effort towards keeping CABS open. For I think that the community needs an agency like CABS around. CABS make a difference in the home care field because of the care we render to our client. We do not only think of them as clients, but we also think of them as our family members. So in rendering care, we try to do our utmost best in rendering whatever care we have to render to the clients. And also our home attendants should be appreciated for the work that they do. You do have a lot of positive feedback from clients. They like when you talk to them, try to help them in whatever way you could. Like, sometimes some of them don't have a family member, they need someone to help them. The nurses go out there, they try to do as much as they could. They would call in the office if someone answered the phone and you try to help them. They very much appreciate the help that is being given to them from the agency. The circle of care does not only include CABS agency and CABS office. We have a lot of programs out of CABS, which is all circled around the clients, including things we could do for the clients in whatever way we could help them. Thank you, CABS, for the Circle of Care Award. And I very much appreciate it, and I wish that CABS would be around many, many more years to come.
We aim to surround our clients and community with all the benefits they might need, which we are not able to do alone. We rely on our community partners to fully meet the needs of our clients as part of the CABS Circle of Care. We want to acknowledge and thank our community partners who helped us get through this turbulent year, such as Heart to Heart International, that donated hundreds and thousands of pieces of PPE that help keep our frontline heroes, clients, and staff safe. And such as DOHMH for continuing to launch programs that heal the community despite managing an ongoing global pandemic. And for all of our other industry and community partners that jumped on Zoom calls and remain flexible alongside of us, thank you.
Yeah, one of the things that I'd like to add in this Circle of Care award is we can't do this by ourselves. And CABS has been very fortunate over the years to establish partnerships with organizations. So these partnerships, they just don't come about, and they don't stay with you if you're not doing your job. So again, the board recognizes and is thankful for these partnerships, and hopefully we'll be able to expand even more partners as this health network again expands and goes and grows.
Hi, my name is Daphne Damas. I'm the Director of Nursing at CABS Health Network. I would like to thank everyone for participating and joining the Circle of Care Awards. We all know that we have been dealing with quite a dilemma with COVID-19, and at CABS it is necessary and it is crucial that we teach our aides to protect themselves and to protect the patients and their families. I would like to thank Heart to Heart for really, taking care of us by providing us with PPEs, which is essential for the aides to stay in the home of the patients.
Congratulations to our community partner and PPE provider, Xavier Hogan and Charles Hugner of Heart to Heart International.
I'm Charles Hugner with Heart to Heart International, and we're honored to be included in the 2021 CABS Circle of Care Awards. As a healthcare-focused nonprofit whose mission is to increase access to healthcare worldwide, We recognize the importance of our partnerships with organizations like CABS who are doing the on-the-ground work to help achieve that reality. Since 1992, Heart to Heart International has distributed over $2.3 billion in humanitarian aid to over 130 countries and 50 U.S. states. Heart to Heart is also active in disaster response, having just deployed a team in Haiti to the recent earthquake and a team domestically in response to Hurricane Ida. Additionally, Heart to Heart works in laboratory programs, community engagement, and could not make any of our work possible without our exceptional roster of volunteers. Heart to Heart first connected with CABS in May of 2020 in the height of the pandemic, providing a small shipment of face masks to help keep their staff protected and to ensure continuity of services in a period of unprecedented uncertainty. Since that first shipment, we have partnered for 4 additional distributions, totaling over 290,000 units of personal protective equipment, weighing in at over 6,000 pounds. Through our strategic partnership with FedEx, we were able to ship all of these items from our headquarters in Lenexa, Kansas, to CABS in New York at no cost. Our namesake originates from our beginnings in 1992 when we organized an airlift from our location, commonly known as the Heart of America, into the heart of Russia after the fall of the USSR. Today we are grateful for this recognition from CABS in keeping this spirit alive with these donations from the heart of Kansas to the heart of New York City. Thank you very much for your time, and congratulations to all of the Circle of Care Award honorees. With our collective efforts, we take the steps to become closer to our goal of a world without barriers to healthcare.
Hi, my name is Xavier Hogan, and I am a logistics coordinator with Heart to Heart International. It is an honor to be named as one of the CABS 2021 Circle of Care Awards. At Heart to Heart International, we know that our mission of improving quality healthcare access can only be successful when done in conjunction with other organizations also working towards the same mission. We are proud to be considered part of this circle. We view our work as a support to organizations like CABS, who are working directly in communities and are knowledgeable and sensitive to the needs of the people they serve. We work to provide these organizations with the supplies necessary to care for their communities. Thank you again for this honor, and congratulations to the Circle of Care Award honorees. By working together, we are all able to get closer to our goal of a healthier world.
How has this year changed you?
The agency was like, you could get a box of gloves, a half a box of masks. I was like, really didn't want to go, to be honest. And I appreciate Heart to Heart for all the donations that they was able to give to CABS to keep the agency afloat, to keep the home attendants able to be protected, to go out to serve the community and to serve the clients with reinforcements for ourselves and also for them. So I appreciate Heart to Heart for all that they have done, is doing, and are continuing to do.
My name is Bart Kelly. I'm the Supervisor of Care Management Services here at CABS Health Network. There's never a bad time to think about care management for your loved ones. The earlier you can identify and enroll in our program, the sooner you can gain the benefits of both the social services support and a greater connection to your community. Here at CABS Health Network, that's what our concept of the Circle of Care is. From the minute you come into the building until you receive any services from one of our trained staff members. Each employee at CABS is dedicated to providing an excellent customer service experience. Stay connected to CABS Health Network. You can find us on Twitter, Facebook, LinkedIn, and other social media platforms.
This Circle of Care Award is being presented to Gertrude Hector.
I started to work with CABS. I used to work in the days like from 9 to 1 and 2 to 5. Yes, and eventually became sleep-in. Sometimes I work 4 days sleep-in at one client, off the 1 day, then go to another client 2 days. Yes, I used to be back and forth. Yeah, I like to, when I'm working, I don't like to be back and forth on the street. So when I'm with the client 24 hours, well, I would take care then, do the necessary and try to converse, with the client and what have you. That's the reason why I like sleeping. I work now 2 days with CABS, Saturday and Sunday. It was my pleasure being here throughout. So I take pride working with CABS, and I'm to perform my duty. Yeah. My name is Gertrude Hector. I started working with CABS 2001, and I just want to thank CABS and the staff for presenting me this award today.
Bill's vision in action is seeing the multiple programs developed and expanding to meet the different needs of the communities. The purpose of why CABS was created back in the 70s is still relevant today, which was to be a resource for quality home care and employment for the underserved. That purpose has always been the message from Bill, whereby CABS is from the community, for the community. Therefore, this purpose has to be demonstrated through our actions and commitment to the community, which includes employing women of color at every level of our organization, from the front lines all the way up to me, a Caribbean American woman from Brooklyn who became the CEO. Bill represents that model of leadership during his tenure at CABS.
I think anyone that knows Bill knows that he's a very affable person, friendly, honest, and like I said, he's like an open book. You don't have to worry that he is going to turn his back on you, or that he's not going to be there for you, because he, he's true to his word. And having done, first of all, business with him, he was always reliable and delivered what he promised. And on a personal note, he's a true friend, and he's a believer. So in that sense, I've never had any doubts about where he stands. Well, the mission today is completely different to what the mission was then. I came to work for the CABS organization, I guess, the late 60s, when I was looking to change my profession. I knew the CABS organization because a lot of the people who worked there were personal friends. My mother worked there, my sister worked there. A lot of the folks who worked with the organization belonged to the church, the community. I had lived in that community all the time that I was in New York. And I went there, and they one of the programs that they had was a Merchants Cooperative, and they were looking for a manager. These were things that basically came out of that small organization in Bed-Stuy that it started, with a grant of about $500,000, and I think that these achievements really exceeded certainly all my expectations and impacted the lives of people not only in the Brooklyn area and in Bed-Stuy, but throughout the whole country. When I first met Bill, oh my God, I think, I met him, initially when I first got the position, and then Bill is a very amiable individual. He was on the board, and then he, of course, he was in the insurance business, and we also did business with him. But I think when we got to know each other better was when we went through the crisis, the funding crisis. I think that he understood that what was at stake, and he was willing to walk the walk and talk the talk, and do what was needed, for the organization to survive. And he, basically, has served in all the endeavors that we have done, not only with the home care companies, but with the nursing home and the housing companies, and to the fact that now he's the chairman. So he was committed and was willing to work hard, and one thing about him is that he never loses a smile.
Our first annual Legacy Award is being presented after 40 years to CABS chairman and co-founder William Andrews.
What it's been like working with you. It is genuine leadership at its best. You are one of my mentors. You are supportive. You are a conscientious leader who wants CABS to have a place in the community. Throughout my journey at CABS, you have contributed to our growth and development while reimagining new ways for CABS to remain a fierce competitor in the industry. As one of the founders of this organization, your vision continues to inspire the blueprint of CABS legacy, which includes its leadership, and I am forever grateful for it. So thank you, Bill.
Well, I just want to say that it was easy to support a CEO like yourself because our vision just automatically matched that we want the best for the community, and we're willing to pay the price, to sacrifice whatever it takes that these people get the benefit that's out there. And you have to have dedication, and you have shown that dedication from the onset, because many of the people don't know it wasn't easy, and it's not easy.
That's right.
And there was some very, very turbulent times. On behalf of the board of directors, I want you to know I accept those words of encouragement and thank you, because we used to say at CABS it's a thankless job, but when you see the performance and the people smiling and said, oh yeah, I know about CABS, and I know, oh yeah, they did this for me, it makes you feel good. My life has been blessed. I've been able to travel all over the world. I've been able to meet all types of people, and I enjoy sharing those blessings with other people. Well, I'd like to acknowledge and thank my wife, Julia, for her support in helping make CABS a successful health network organization, because you can't do it by yourself. It requires a team effort. And likewise, for our prior executive director, which was Mr. Allione, his wife Phyllis, and again, another great director that we had that was brought in, Shirley, and recruited her, and that's Bill Pernisic's wife, Manola, because she has also, as men, we always sit back and talk about it and say, thank God we got good wives and that support us. And so, I mean, kudos to all the women in CABS. Being a recipient is a great honor to me, but I take this award on behalf of everybody. It's never just one individual. I take this award as the workers, the staff, the dedication of our CEO. This has proven that if you get people working together, putting aside petty differences, the community can benefit. I take this award on behalf of everybody. It's not Bill Andrews. I'm just a figurehead that happens to be the chairman of this organization, and I'm honored to do so and to be able to take this award on behalf of everybody connected with CABS Health Network.
Congratulations to our community partner, Beatrice Mauger, New York City Department of Health and Mental Hygiene.
Thank you so much, CABS Health Network, for honoring me with the 2021 CABS Circle of Care Award for Community Partnership. I'm so thankful and humbled, and I wholeheartedly accept this award, so thank you. I just want to acknowledge that over the past 18 months, those working with and for communities have been pulled into so many various projects and jobs to help their community members protect themselves from the coronavirus, and also to recover from COVID-19 or the grief of losing a loved one to the disease. And despite the pandemic, I'm so appreciative of CABS' diligence and hard work in making time to help me set up and launch the Medicaid Together project. And this pilot project aims to connect most children hospitalized due to asthma who are on Medicaid or Child Health Plus and are allergic to pests in their home with quality pest control services and case management. And I'm particularly thankful to Belinda Freeman, who is able to get contracts signed with several health plans and set up 7 hospitals so far to refer children to the project. And Belinda also made sure that CABS had the processes and resources in place to connect the children with the integrated pest management. And I'm thankful for all the staff at CABS who've helped Belinda put these processes in place.
This Circle of Care Award is being presented to Olga Perez.
My name is Olga Perez. I le doy gracias a CABS por este Circle of Care Awards, right? And por a todas las empleados y a los clientes que yo tengo, por los años trabajando en esta compañía, nunca he tenido quejas de ¿cómo se llama? De las personas que trabajan con mis clientes. Gracias por todo y gracias a las personas aquí que me han ayudado con esto y gracias por todo. Gracias por venir al Círculo of Care.
This Circle of Care Award is being presented to Sophia Grinberg. This Circle of Care Award is being presented to the family of past client and elder care advocate, the late Lainey Haynes.
Well, if you ever had the pleasure to meet Lainey Haynes, you would find that she was not only a caring person, she really loved people. And her motto in life was,
if I could help someone along the way, then my life would not have been in vain. That's her motto. That's what she swore by all the time. And
she tried to live her life to reflect that philosophy. I mean, she was a woman of honor, integrity, and she had an infectious personality, a wonderful laugh. I mean, you know, she didn't take herself too seriously, but she took her work very seriously.
To give you the idea of just how my mother was, I remembered, and she didn't want to be a bother to anybody. That was just her. She wanted to be independent. And I remember one instance where when I had polio when I was 3 years old. And so every year they would have this camp that we would go to. After the third year, I remember somebody said, "Who has no worries?" You know? And one of the counselors says, I got him. And I was wondering, what is this no worries? And that's what they called me, because a lot of the kids that were there, they only had enough clothes to last for 3 days. And then the counselors would have to wash these clothes to make sure that they could continue for the 10 days. Me, I had clothes for every day. Every piece of my clothing had my name inside embroidered. And it was just something. But that's the way Mom's was. She did not want to be a bother to anyone, and she didn't want her son to also be a bother to anyone.
Lainey came to CABS about 2005. That's when the relationship started. She had major surgery, and she was amputee. And when she came out of the surgery, she had a really positive attitude. I mean, she wasn't ready to give up on life. She was ready to embrace the future and what lies ahead. But that's how she was, because she was deeply grounded in her faith.
I enjoy working with the help that's sent to me. And in fact, we get along like family. I don't know, but the help that I have now, the aides seem to take me as a second mother. I love that. And it's easy to work with everybody that I have worked with from CABS. We're very understandable, and we get along well.
Yes. We never expected to find home attendants as dedicated and as caring and really as loving as the two that worked with her for so many years. Another thing that really made her happy was when CABS chose her to be a model spokesperson for their marketing campaign. She was featured in a lot of the ads on their, I think on the buses, and they had pamphlets, and they even had a giant poster of her at the Circle of Sisters. She was just so happy and so honored, really, to be a part of their campaign and to represent such an organization as CABS that, gave really good quality care and most of all had integrity.
There for almost gonna be 40 years on CABS. It's not like, I'm just old school who tell you stuff. You have to know CABS agency is just like, you just a family to them. You call the supervisor, you get them. If they don't get one of them answer you. And if you don't, you can leave a message and you get back. Anybody can get back to you. But they are family. They care about you. When you have trouble, you explain to them what's going on in your life. It's just like their family got trouble also. So you have to know, if you want a good agency, believe me, darling, that's the best agency, that's the best family to enter, CABS agency.
Family for life.
Amen.
Amen. Thank you, Miss Lady. Thank you, CABS.
Thank you, Mom.
This Circle of Care Award is being presented to Hildred Rattigan.
You always help yourself. You never sit down. Sometimes I go to get angry and say, Queenie, leave that and go sit down. And leave it for later. You don't have to rush to do it now.
That's not me, though.
Huh?
That's not me. My mother raised me to do for myself.
I know. And sometimes I say, don't put too much weight on your leg because I don't want it to get swollen. All right? And when we went to the doctor, I said, make sure you have your alarm on you. Like the other day went off and we never know. CABS, I thank you for the award. When I get the letter and read it, I said, what kind of award is this? What it is for? And I was kind of anxious to see what's going on. So, I was a little bit excited. I thank you very much because I'm working with O2. It's a long time I've been working for CABS and I don't have no problem. I never make no complaint. I never call and said nothing. Everything will run smooth and fine. I thank you for the award. So when I come up there Friday, I see what the award is because I never get an award. So I thank you and everybody in the office. Some of them that I know them for so long, because almost 9 years. I thank everybody in there. And may God bless all of you and keep you safe and fine.
Passing the baton to me is an honor. Bill and I share common ideologies about the CABS expansion of new programs and jobs to develop a network around the community. Additionally, we believe in mission-driven leadership by being a good steward to the cause of serving the people, the common man. As the current leader of the organization, I received the baton and have to continue to find ways to address the needs of the community and fill in those different gaps. Lastly, there is a saying that goes, trust begets trust. The trust between Bill and I has allowed me to think big. with controllable risk, it has allowed for the company to benefit and reach new heights in preparation for the future.
We knew you could do it, and you've done it, and you'll continue to do it. And as a leader, you have to inspire people.
Right.
And I can tell from the people that you have selected and hired, you've inspired them. I'm very impressed. You know, and that's what it takes to make a successful organization.
Thank you for joining us for the 2021 Circle of Care Awards. See you next year. Follow the CABS journey on social media and learn more about ways we can partner to change the community. Visit CABS at www.cabshealthnetwork.org.